So we'll call the meeting to order. We can proceed with the pledge. As soon as I find that.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For the last time this body met was, where the heck's that?
26.
Was 126. So minutes were sent out to everyone from that meeting. So I take a motion from a doc to approve. Motion by Dr. Delaney,
Second.
enforcement list. The time I figure out these changes. This is a big one, so.
Since our last meeting, one added on 5/7/26, Brett Cohen from Pine Bush, New York. 800.16A2 has been negligent in the performance of his or her EMS duties and practice, and 800.16A4 has abused a patient as patient abuse. Suspended 3 years, effective 5/6/26. That's it.
Correspondence we can cover under CMAC Semsco. Mark, do you want to present the thing you sent me today?
If you want, that's up to you guys,
Be
right?
under CMAC Semsco, so.
Yeah, whatever you want me to do it, I don't care.
Okay, we'll do it now.
So CMAC and Semsco were middle of last month. The Bureau Director's report is attached. The rest of the minutes aren't quite complete yet. It was a relatively calm meeting by the sounds of it. Nothing overly earth shattering. Stare at the one in front of me, since you're making me dizzy.
Sorry.
The MSC position, is going to be posted, if it's not already. It will be posted soon. Vital Signs is in November in Niagara Falls. There were 9 people that went up on the memorial this year, and they've updated their kiosks with a biographical information on them. There's some ambulance build standards that will be coming out. The cameras seem to be relatively controversial. Cameras are not required for ambulances. They are required for fly cars and ESAVs, beginning, I believe, in October of 2026.
The new one's in production.
If it's new, if they currently registered before October 1st, they do not need a camera. If you're registering them after, with your agency, new to your agency after October.
New to your agency.
New to your
If it's a
agency.
used one.
If it's a used
so-
one, you still gotta do it. There's a research forum coming up. They're kind of pushing some guidance on AI, with the idea of, be careful when you use it, use common sense and be mindful of HIPAA, et cetera. That policy statement will be available shortly. There's a new policy on responding to nasty infectious diseases, that is kind of reiterating, updating, I guess, the previous Ebola / COVID guidance, based off it's a little bit more of a, I guess, generic policy. There's some reorganization within the division, or the leadership actually the division reports to, and I may have screwed this up, but it sounds like Mark Hennessy got a little bit of a promotion or movement to Centers for Healthcare Provider Services and Oversight, and Stephanie Schumann is going to be the one that kind of oversees the division of EMS. The one that's kind of above Ryan. And the new, they are requiring, weight-based measuring devices on all ambulances, including BLS ambulances. Just so there's a resource for everybody. So if you have a BLS ambulance, you've never been required to have a length base before you need to get one. And the exciting news, the protocols are going effective September 1st due to the cancellation of the February meeting. The change log is out there.
I will send it out to the REMAC as well. It didn't make it out to you guys.
And
And there's gonna be mandatory training.
there's going to be mandatory trainings. The entire protocols, and I will send them to Jonathan, and it's like 200 and something pages long. So I didn't send them to him, ask him to print it out. The one big thing to touch on, well, we'll go back to general protocols for a second. Most of it is alignment with the updated HA recommendations. There's some wording changes, but most of it is, if you scroll through it, consistent with the American Heart Association 2025, and then clarifications. Gross meat or LASIK is being added back into the formulary exclusively for community paramedicine / mobile integrated health patient-specific protocols, not in the collaborative protocols. It's added to the formulary, not the protocols. Yes. So it will be an option for CPMIH patients in certain areas. Yes. Spinal motion restriction. Jonathan, if you can grab that PowerPoint, please. And go to like page 10, I think it is. Well, we'll stop right there. There's a beautiful little study that says that spinal motion restriction basically has no apparent clinical value. It's a retrospective study. Some states have basically outlawed collars and backboards. New York State chose to kind of follow the Canadian guidance, which removes the word should and changes it to should consider utilizing a cervical collar in specific patients that include neurodeficit, cervical tenderness, intoxication, altered level of consciousness, or any distracting injuries. The people that are over 65, this was pending staff approval, which was done. Staff had requested that they emphasize people over the age of 65 a little bit because they are at higher risk. So the consideration should be a little greater for folks over 65. However, there is also some challenges with properly fitting a rigid cervical collar on some of the geriatric people. And so trying to get a cervical collar on some of those patients will actually do more good. There is extensive training that's coming out about this, and there's going to be extensive training going to schools as well, so we don't have the fights of the past. And one of the things they are going to be emphasizing is our roles. And I'm not so sure that we're not going to see maybe a little bit of suggestion or an okay on soft collars, but that time will tell. But in talking to the page, the last sentence says there's conclusions, there's really nothing. So the goal here is to kind of reduce use of spinal motion restriction while also giving providers the ability to make a clinical decision that allows for it. One of the examples they came up with is, the days of fighting the drunk to get a collar on them are over. and let bygones be bygones to really get them on a stretcher, get them secured with their head elevated. Can reduce spinal motion the best that we can in some cases. And, there's has been no demonstrated evidence that spinal motion restriction really does anything. The next page, I believe, highlights that. And then if you go to like page 10, this is the old one. And this is the new one, or the proposed one. And again, if you look at the red, consider the use of an appropriately applied cervical collar for those patients. And then at the request of staff, it sounds like they're going to be emphasizing the greater than 65 a little bit better for consideration. Again, these all go into effect September 1st. The providers are going to be giving education on them through Bud Sense Academy that we've got Daly's working on.
And that's gonna be a requirement.
And it's going to be a requirement. And it sounds like they're also going to be trying to get some stuff out to the facilities, especially on spinal motion restriction. So we don't have the fights of the past with that, and also updating protocols for those. Explains cement and sense go forward.
Steph, do you have anything to add?
No, I don't think so. I just think, I was glad to see they held off till September because gives them a chance to get it done, get everything uploaded. Summer's just not a good time to try to do that for them. So Dr. Daly said he would, I think, didn't he say he had that done in June? He
Yeah,
said he
yes.
would have it done in June, so that'd be good.
State EMS update, Vinny or Mike or Curtis? Bueller?
Paper, scissors.
Good evening, guys. Not much for an update. With SEMSCO was just last week. We've got mental health symposium coming up next week, if anybody will be down there. Keep looking on our website for any updates and any other changes. There was a new policy statement that got released last week. If you didn't see it. On the education front, course sponsors renewals are due by the end of this month. So if you got those, that's all I have. I'm not sure if Vinny or Mike has anything else.
I think Vinny left us.
I think Vinny left, but I don't have anything to add.
Okay, moving on to air medical reports, either Tuttle or Matt, whoever wants to go first.
Oh, wonderful. Thanks, Mark. Coming up June 27th, we're doing our 10-year ribbon cutting anniversary of the opening of Rome at the Griffiths location. Open to the public for a couple hours. That stuff will be on our social media. October 2nd is on Vernon Downs Fall Education Day. We get a ton of people from up here, so I'll pass along the flyers and the reminders and stuff. We seem to get a huge outpouring from the North Country, so I'll keep everybody abreast as we're figuring out who's coming and speaking and what topics. And then the trunk retreat that we're doing for the open to the public is the October 23rd date. Other than that, it's busy season. If you see us, I'm glad the weather could support it. It's winter and this spring we're a little rough. But other than that, if anybody has anything, just give me a holler.
I have nothing to report for Life Not in New York. Amber Hunt's somehow didn't make it onto the email list, so when I texted her this afternoon to say, are you making the meeting? She said, I didn't know about it. Would you let them know that there's nothing to report? Okay.
Do you know what your scratch rates have been with the weather? Other than
She
I
can
know.
get the, I mean,
the weather?
I can get those,
Awful.
Yeah.
but it was, I know this winter was was
The
not
spring
great.
too, I mean, the wind and everything,
Yeah.
it just made it very difficult for you guys to.
I know that scratch rates were high. But I'm out of the loop, to be honest. I'm only flying super part-time.
Super part-time
Yes.
versus part-time.
Correct.
Oh, good.
Alright, thank you, sir. Fort Drum EMS report, I don't see Dr. Hodge here. They did go live with their new protocols. Are you guys noticing anything different at the ER?
They haven't been in service. They haven't been in service.
That's easy.
Yes, because it's a hiring freeze and they are short staffed. So if they don't have a full crew overnight, they're shutting down the truck overnight.
I don't think they were in service today because Evans Mills,
I was gonna say,
Black River got 2 calls today.
I did hear they pulled 368 whiskeys to run as basics.
Yeah.
They told me that all 3 trucks were down the other day. Friday, Saturday, Thursday, one day I talked Thursday.
So I think they're going out there.
And then Thursday, I took somebody said all 3 trucks are off the
It
road.
would be nice if they shared that, and
Yeah,
communicated that, so the other services could.
And I was like, okay.
I was out there today and put the trucks listening for me. Oh, it was on the road. Okay. I don't know if they were on fault. Yeah, there was Thursday, we trusted all 3.
Others took 3 calls on it today.
I heard it was something.
It would be nice if they could communicate when they're down, so the other services could.
Staff appropriately.
Then they were all 3.
Protocols, we already talked about all of that, so
I do have a question on that. I'm just curious who they're directed to. On the RSI, they have increasing the rocuronium dose to 1.5 milligrams per kilo. Which just seems, it's typically, I mean, subsequently is 1 to 1.5, pretty standard across the board. And rocuronium is, for as long as I can remember, has been 0.6 milligrams per 1.2 milligrams per kilo. So I'm just curious, that is a high dose of rocuronium that does not meet nationally accepted standard.
I will be happy to start an email with Dr. Dale
Yeah.
and you.
Yeah.
1 per kilo.
Do you agree
I
with
use 1
point?
per kilo.
Yes,
Yeah, I mean,
Because the math, it makes math.
makes easy math, I agree, I do the same thing.
Yeah.
me too.
Yeah, I don't know. I haven't seen anything in
That's
the Harvard literature
typographical,
either.
If you want, you can ask a question
I would,
to the collaborative.
but that definitely shouldn't, in my opinion, be
And I haven't seen anything in our literature either.
Does it identify actual or ideal?
so ideal body weight.
Maybe that's the rationale for the increase and everything. I have.
And that's what's supposed to go in effect in September.
Mhm.
I wonder what they would consider my ideal body weight.
Looks like I think.
That's why I'm saying, maybe that's the increased dose. I'll get an email out to the collaborative committee and make sure
Yeah, I think the questions were.
you and, Mark are on it.
Thank you.
if anybody from this committee wants to go on the collaborative protocol committee, just let me know.
Yeah.
Quality corner, I know you've talked to Melissa a little bit, but no. So we'll try to get that jump started again. Okay, program agency. Got a couple different things, but we'll do this one first, maybe. Not a whole lot to report on, not that we haven't been really busy, but it's not a lot in here. So medical director changes that we'll need a motion on, so Suni Canton is switching to Dr. Howland. So we'll need a motion from some, Dr. Delaney makes the motion, do we have a second?
Second.
Dr. Gray seconds, any opposition? Hearing none, that change is approved. New AEDs, the town of Theresa, has a new AED. BLS adjuncts, so Beaver Falls submitted their training and everything for, BLS IGEL. So we need a motion to accept that or approve their training, so we can tell the state that the REMAC has approved their training and the state can approve them to do eye-check. Dr. Delane makes the motion. Do I have a second?
There was a lot of discussion at state council on the eye gel or the supraglottic airway. And a couple of the docs are very upset that first responder agencies can't do eye gel. And Dr. Bombard said, that's what I wanted. I wanted them to be able to do that while they were waiting for the ambulance to get there.
EMT or both.
So I think that's gonna be hopefully maybe turned over here in the fall, because they're saying, well, you know, we don't oversee them, but they don't with the epi, they don't with, you know, any of the others. So what is the, but she was very upset because she said, that's why I wanted to do it while they're waiting for an ambulance to get there to put that. So
Yes.
hopefully there'll be more changes, maybe another change to that.
Need a second still for that.
Oh,
Beaver Falls, right?
Second.
Seconded by Dr. Gray. Any opposition? So the paramedic scholarship, so we closed out phase 1 of the paramedic scholarship program on April 30th. We meet tomorrow to select our recipients, with the committee. And then, but we have rolled out the second year of it. So the reason the first one was done in that April timeframe was because we have to spend out our money before the end of June, or else it's gone. So that was more for people currently enrolled, or if you've already received your fact that you're enrolled, you could also apply for it then. Moving forward, the scholarships will be for people who are going into the program. So our deadline is July 1st, so if you know anybody who is looking to go to paramedic school, the paramedic school does not have to be located in the program agency's jurisdiction, so it can be the Herkimer program. It can be SUNY Cobleskill, it can be, there's a Hudson Valley Community College, Syracuse does. The only thing that really ties is that provider has to live in the region and commit to practicing it. They don't care where they go to school, and payments will be made to the institution, not to the individual. Recruitment and retention initiative, so we are blasting all this out. Hey, look, Amanda. Hey. So if you have any agencies that you want to get involved with the EMS internship program that the state offers, we are co-branding stuff like that for them. We are working on a draft policy for agencies to be able to adopt, because you have to have a policy with the state that the state approves to be able to participate in it. You sent it to me, I just haven't.
Yeah, I sent you, and ours was approved by the state, so, because we, and that's one thing everybody needs to know, is you have to renew it yearly.
Yep. And I've talked to Erica too about if we just, as a program agency, put one in and submit it, and then have all the agencies just fall under ours if they want to.
That's what we did in Jefferson
You
County.
get that as a county
They
for
wouldn't
the
accept
first
it.
year,
No, every.
and then they yank that.
Well, that's stupid. Okay, so trainings, Spring Fling was April 16th through the 18th. We had 119 attendees. And all of the reviews that we've gotten back have been very positive. Debbie and I need to set up a meeting with the committee just to go over and look at all of that and start planning for next year. I already have the call for speakers built, so give it a little bit of time and that'll be out. I definitely think being ahead of the curve this year really benefited us when we were able to get it out earlier. I mean, registration was able to open just after January 1st, which is a huge difference from what we've had to do before, where we're panicking and frantically.
It worked this year.
And the vendor turnout was amazing.
Yeah, we sold the vendor room out.
That was, and some new vendors.
Yes, a lot of new vendors who all have said, yes, we'll be back next year. So I think we might actually run into the problem next year of not knowing where to put all the vendors. And if the weather's as nice as it was this year, we'll put them outside. And then, some upcoming trainings Fort Drum EMS Day is this coming Saturday. We filled 19 of the 20 slots. We had to close registration today so we can get everything turned into Fort Drum for people to have access to the gate. But really happy with that. We actually are incorporating an ASHI ACLS or COS? ACLS, ASHI ACLS into the day too. So, as part of we're using part of our recruitment and retention funding to pay for them to get their ASHI ACLS. Whether the state chooses to accept that or not, it's a different story. And then upcoming trainings that Amanda's worked on for the LMS are listed there.
And I just want to say, I reviewed them all for her and she did a remarkable job. The Many Faces of Shock is really good. All of them, I reviewed them all for her and she did a fantastic job and it's gonna be some really good training for folks to go on and get. So really good job. Well done.
And another thing that will be coming, because I won't bore you guys with the entire breakdown of the recruitment and retention stuff like I am gonna Remsco. But we actually have entered into contract with Mark Spezio, who is in Washington County, and Dan Batesy to develop a leadership track for our learning management system, which will be Mark is gonna focus more on the New York State side of things and aligning your practices to move your agency forward and help build new leadership. And Dan is gonna focus on actual leadership development. We're really excited for that. I just got their contracts back, so, the goal is to have that live by December. And of course, we're gonna throw Debbie in there as much as we can too, because she knows all the OSHA, yes.
Exciting stuff that'll be.
Excited stuff. So miscellaneous, the stuff that we participated in, I forgot to change the dates on this slide, so that's on me. The next state meetings are in September. They are the 15th and 16th. Happy birthday to me. I get to be there.
Hilton Garden Inn.
At the Hilton Garden Inn in Troy, New York. They have great ladies there though, so I won't complain.
Monday night is waiting night.
And again, anything that needs to be submitted to our office, please use the paperwork email address. We still have a lot of people that are submitting stuff individually to Amanda or to me or to Zach. And then they'll email whoever they didn't email it to going, where is this? And, oh,
We
Yeah.
need to make sure everybody knows that Dr. Delaney received the Lifetime Achievement Award at Samaritan. And Jonathan and I attended that when did we go? March.
End of March.
And it was a very nice evening and she did very well with people talking and,
Did she stand up?
She did. She gave a good speech and.
Oh, she talked in front of people too.
I'm on camera, so I need to behave myself.
Nice to see you get the recognition, so.
And three of the people that did give her a speech were Dr. Chafe, Dr. Flint, and Dr. Maynard. And it was pretty fantastic.
I would like to see
They're,
that roasted.
yeah, they're
Senator Delaney.
looking out for other events.
Actually,
It's quite, entertaining.
they want to do spring fling.
Oh, I would love that, especially if we're gonna roast Sarah.
Different topic.
And then, so the only thing under your new business is just the VLS Superglide approval process. So I'm gonna work on with Dr. Delaney and Debbie basically a generic document for the region that is a training and all encompassing. Mountain Lakes actually did it, and it's Dr. Gerling from Glens Falls Albany Med developed the training with Skiesboro. It's really solid. It's very all encompassing. I don't see any point in reinventing the wheel, and they said anybody can use it that wants to use it. So I'll get that tailored to more our region specific needs, and then we'll have it to review at the October meeting.
So I would like to make the recommendation that once this is complete, we don't hold people up until October, that Dr. Delaney has the authority to grant so that we don't hold people up. If somebody wants to go live, that we're not waiting until October. Because I don't know how long it's gonna take once it goes to the state to get their approval, but I would hate to hold somebody up that wants to go live with a super gladic for.
Yeah. Can I have a motion from a doc on that? Or you're a member, you can make, that doesn't need to get doctor's motion, does it? So Debbie made the motion, can I have a second from, it doesn't matter who. Mark or Amanda, whoever you want to write. Any opposition? Hearing none, we can move on. Other new business. Do we have anything else from the floor that anyone wants to talk about? Hearing none, I'd entertain a motion to adjourn. The next meeting would be October 5th at 5:30.